The governor of Nairobi, Sakaja, has received the task force report on health reforms that is meant to work towards universal coverage for the people of Nairobi. The report was compiled by a task force of health professionals, executives, and consumer advocates who were appointed by the governor on 14 September 2022.
This task force was formed to really reassess health strategies and plans of this county in order to meet the evolving needs in a bid to ensure healthcare in Nairobi works.
The task force was headed by the chair Dr. Githinji Gitahi and new county health minister Dr. Anastasia Nyalita, compiled of 8 voluntary members supported by the organizations such as AMREF, USAID, Afya, Ugavi, and Kenya University Referral and Research Hospital. It adopted a highly participatory and inclusive approach involving document review and engagement with various health sector stakeholders through workshops, town hall meetings, public forums, submission of memorandum, and benchmarking visits.
But it is very clear that what the governor intended to do was not establish a representative task force. The governor intended to establish a team of people, what you may call gatherers of knowledge, to gather the knowledge from the stakeholders themselves, so that we go out and we ask the people, what exactly do you think is needed to make the health sector work for Nairobi? To enable this to work, to enable an operational primary healthcare service, we need to operationalize the Facility Improvement Fund Act to allow devolved facility level responsiveness. This is a major challenge in this country, where facilities before 2012, any of you who knows the health sector will know that before 2012, every facility had some money. That money was used by the facility in charge, together with the facility-based committee, which is made up of members from that catchment area, women, people who are living with disabilities, young people who guide the facility in charge, and they can decide how much to pay for water, how much to pay for electricity, when to cut the grass, if the wall has collapsed, how to repair the wall. But that was taken away from facilities in 2012, Governor. The reason it was taken away is because of the County Act. We have to also ensure that we focus on reorganizing, reviewing public environmental health and water and sanitation and hygiene services, including the legal framework to support it. That if we want to have bylaws to ensure that people don't dispose waste, that they put others in danger, that the environment will be maintained, that we don't have people who are disobeying anti-smoking regulations inside public places, then we have the framework, the legal framework to enforce it. Then we ensure that will reduce the disease burden.
The task force received a lot of views from the public and stakeholders on all the 6 terms of reference, which were citizen access to quality health service, the status of all public health facilities, the supply chain management of pharma and non-pharma products, the county health information management system, health resource capacity, and efficient health financing model. The task force has detailed in the report key findings and recommendations that the governor has committed to establish to achieve a universal healthcare system.
Not commit, and I will not let you down. I cannot waste the time of Professor Mugenda. I cannot waste the time of Dr. Githinji, Anastasia, CS Mercy, Kare, that you've done all this work for us to put a report in the shelves of our offices. I would not do that. So I commit to implementing the recommendations made by this task force for the benefit of the people that we serve, the people of Nairobi.
Reporting for The Voice KE, my name is Collins Macharia.